Bismillah Rahman Rahim. In the name of Allah, the most gracious and the most merciful. Assalamu alaikum. Peace and blessing of Allah and His mercy upon each and every one of you. Diabetes and Ramadan fasting. This is Dr. Askar Yasmin Siddiqui from Toronto, Canada. I have made an humble attempt to record this video to help all the Muslim diabetics regarding fasting in Ramadan. Bismillah. Fasting is one of the five pillars of Islam. The Muslim fast from sunrise to sunset in the whole month of Ramadan. They abstain from eating, drinking, and sexual intimacy during this period. These prohibitions are lifted outside these hours. Ramadan is the ninth month in Islamic lunar calendar. The lunar month follows moon cycle, which is 29 or 30 days. It moves ahead or advances forward at the rate of 10 to 11 days in the succeeding year of the Gregorian calendar. In the celestial sense, it traverses all the season over time. In a spiritual sense, the Muslim enjoy fasting in different seasons. Short cool days in winter and long hot days in summer, and some in between. This variation of experience is a great feature which helps Muslims to adapt to changing conditions. It is a remarkable aspect of Islam to develop healthy and positive attitude to face challenges of life. In Northern Hemisphere, like UK and Canada, the fast in the summer can be as long as 16 to 20 hours compared to 7 to 11 hours in winter. This year in Canada, 1437 AH, fasting is about 17 and a half hours. Let us see the physiological changes in the body. The Sahri meals provides energy in the first few hours of the fast. The body uses the blood sugar as its fuel to run its function. The duration of energy provided from the meal is dependent on what is consumed at Sahri time. When this is used up, then the body starts to use the stored energy from different organs such as liver. This switch is a gentle transition. It is like an alternate power generator. If the fasting continues, then the fat stores in the body is called upon and utilized. Your weight changes, your blood sugar and blood cholesterol is reduced. In other words, we can say that fasting fine-tunes your physiological system. Also, fluid restriction causes dehydration. There are lots of benefit in fasting, physical, psychological, and spiritual. It is a good detoxification exercise. It increases the fat burning mechanism. Toxins in the fat are dissolved and removed. It improves cardiovascular system. Your blood pressure, especially systolic blood pressure, is reduced. It also increases insulin sensitivity, so your blood sugars are under control, which is a good news for pre-diabetics. You lose weight or even maintain weight. But if you are gaining weight, remember you are doing something wrong. It reduces the markers of inflammation, reduces the risk of cancer. It increases the activity of the cellular repair. It is a good for your immunity system as it affects the stem cell function. It fine-tunes your physiological system. Overall gives a general feeling of well-being. Let us see what is diabetes. Diabetes is a health condition where the amount of glucose in your blood gets too high. This happens if your pancreas doesn't make any insulin or enough insulin to make the glucose enter the body cells, or the insulin it does make doesn't work properly. Insulin is the hormone produced by the pancreas that allows glucose to enter the body cells, where it is used as a fuel for energy so we can work, play, and live our lives. Remember, insulin is very vital for life. Glucose comes from digesting carbohydrates and it's also produced by the liver. If you have diabetes, your body cannot make proper use of this fuel, so it builds up in the blood, which can be dangerous. There are two types of diabetes, Type 1 is when the body is unable to produce any insulin, which we need to break down the glucose in what we eat or drink. We don't know exactly what causes it, but we know it is not to do with being overweight. You cannot prevent type 1 diabetes. It is usually diagnosed when you are a child or a young adult, although it can occur in older adults as well. Approximately 10% of the people with diabetes have type 1, whereas type 2 diabetes develops when the body cannot make enough insulin or when the insulin produced does not work properly. Your family history, your age, your ethnic background affects your risk of developing it, and you are more likely to get type 2 diabetes if you are overweight. It starts gradually, usually later in life, and because the symptoms may not be so obvious, it might be years before you learn that you have it. If undetected, can lead to serious life-threatening condition. And approximately 90% of people living with diabetes have type 2 diabetes. Also, there is something called impaired glucose intolerance or borderline diabetes. These are the people whose insulin is not working properly, yet they have not met the criteria to be diagnosed as diabetes, but they are like pre-diabetics. Let us see what population we are talking about. The International Diabetic Federation estimated in 2013 that globally there is 382 million diabetics in the world, and Muslims are about 1.6 billion Muslims in the world. Out of that, 90 million Muslims are diabetic. That's a large number. The South Asians have the highest rate of diabetes. For instance, in Hyderabad, India, there's a 24 lakhs diabetics, and in Pakistan, about 1 crore diabetics. And it is said that after the age of 45, about 25% are diabetic. There are some studies done investigating the effect of fasting in Muslim diabetic patients. The most extensive study is EPIDIOR or Epidemiology of Diabetes and Ramadan. This was performed in 13 Muslim countries and involved about 12,000 patients. The EPIDIOR study reported that 40% of patients with type 1 diabetes fasted and 80% with type 2 fasted, irrespective of the advice given to them. About 80% of the Muslims with diabetes fast for more than 15 days. It has become a medical challenge for diabetic person to fast and also for healthcare professionals. It is not only a community problem but an national problem. It is ethically binding on medical profession to respect and support your decision to fast. They should provide help and advice management because it has become a global medical issue. Fasting is prescribed for a healthy, mature person who is in a state of purity and living in its hometown. Allah, out of His infinite mercy, has exempted certain people who are sick with certain illnesses because He wants living and worship easy for us. But neither Quran nor Sunnah specify any illnesses because it depends upon the tolerance, upon the piety, upon consciousness, and the intention to serve Allah subhanahu wa ta'ala. Muslim scholars have recommended and identified certain illnesses who should be exempted, like cancer, ulcers, bleeding ulcers, diabetic, and other diseases. So, if the individual is sick with certain illnesses, especially uncontrolled diabetes and certain kinds of diabetes, then he should take the privilege as a blessing of Allah subhanahu wa ta'ala and do not deprive yourself with His rahmah. To fast or not to fast, it is your personal choice. Fasting has been discouraged by healthcare practitioners. The Holy Quran clarifies that people with illnesses are exempt from fasting. However, many diabetic individuals are still keen to fast as they do not consider themselves unwell and exempted. If an individual is advised by a doctor that fasting would be detrimental, then most Muslim scholars would agree that the individual should abstain from fasting. It is imperative that you feel supported in your choice to fast and that your choice is respected and managed accordingly. Remember, if you cannot fast, you can complete your duties by offering charity, a full meal, or a cash value to a poor person. Or remember, if you cannot fast this Ramadan, you may be able to make it up at a later date, perhaps during winter months. The question arises, what shall I do to get ready from the medical point of view? Medical examination or medical consultation is of paramount importance. It should be done as early as possible, preferably 1 to 2 months before the beginning of Ramadan. Fasting is a lifestyle modification. It's a lifestyle change. It can be discussed at any medical appointment and can be done by a diabetic nurse, diabetic doctor, or even a family doctor. It is possible to do a pre-Ramadan assessment to assess the risk of fasting, just like a diabetic woman is assessed routinely with preconception to find out the risk and benefits to the mother and fetus. Make sure you get a complete medical examination done, some investigation which will include blood sugar, blood cholesterol, urine test. Also get your eyes and feet examination done. Explain the nature of the fast to the doctor. Explain the duration of the fast and make sure you inform that you do not eat, do not drink, not even water or even take medication during the fasting period. Explain the style in which you are going to eat during Ramadan. The meals you will be taking, whether it is just sahri and iftar, or you are going to have sahri, a light iftar, and then few hours later a dinner. Ask your doctor to review all the medication and adjust not only diabetic medication but other medication which may have impact. For instance, blood pressure medication, which is like diuretic, should be discussed with the doctor. Also, you can do istikhara and make dua, and then even a trial fast can be done in the month of Shaban, a month prior to Ramadan, for 1 or 2 days to see how you feel. This slide will help you and give you an idea about how to make the best out of your doctor's appointment and what question to ask your doctor. If you like, you could pause the video and copy the points from the screen. Let us see what is the outcome of fasting. Fasting can improve your health, but fasting can be detrimental. Remember, Ramadan does not entail fasting only, instead cycles of daytime fasting and nighttime refeeding. Health concerns therefore stem from both fasting and refeeding. So pay attention to what are you eating and drinking? How much are you eating and drinking? How have you adjusted your medication? And how long is the duration of fast? Therefore, the deciding factor is indiscriminate indulgence of wrong foods, improper dosing of medication, or even self-adjustment, which can be a source of risk for all the diabetics. Let us see what happens to your body when you have diabetes and you fast. As I mentioned, at about 8 hours after Sahri meal, our body starts to use energy stores to keep our blood sugar level normal. For most people, this is not harmful. But what happens in diabetic, the transition of energy utilization from blood sugar to stored sugar is impaired, or you can say it is not as smooth and gentle. So you are at the risk of developing low sugar reaction or hypoglycemia, and the risk is greater as the length of fast increases. It is also noteworthy that this year the fasts are very long, therefore there is a greater chance and greater risk of developing hypoglycemia or low sugar reaction and dehydration. It is also noteworthy that Ramadan does not entail just fasting only, but instead cycles of daytime fasting and nighttime refeeding. And if you have diabetes, you are at a risk of developing high glucose level or hyperglycemia following the larger meals that we eat at Sahri and Iftar. Let us look into each of these complications. Hypoglycemia, low sugar reactions occurs when your sugar level drops too low for your body's needs. And this is because of the prolonged period of no food intake, which puts you at a higher risk of these events, especially if you are on medication like sulfonylurea, dimacron, glyburide, or even on insulin therapy. Our current knowledge comes from the same study EPDR, in which they found that the risk of severe hypoglycemia leading to hospitalization was about 4.7 times more in type 1 diabetics and 7.5 times more in type 2 diabetes. Hyperglycemia or high blood sugar levels. You may anticipate that by decreasing food intake, you would be less likely to have high sugar reaction. Actually, it is more possible that you have deterioration of glucose control. In fact, the EPIDAR study shows that hospitalization is 5 times more in type 2 diabetics and 3 times more in type 1 diabetics. This increased event rate appeared to be related to excessive reduction in medication or also and also from overindulging and feasting either Sahri meal or Iftar meal. Diabetic ketoacidosis is a serious complication. It occurs as body cannot use sugar as a fuel source, so it uses fat instead. It can be easily diagnosed by checking your urine with a strip. You should be alert if you have infection, which makes you more prone to have ketoacidosis. Remember, some medication also make you more prone to develop ketoacidosis. Fasting can put you at a risk of dehydration, and the risk increases in long hours of fasting in the summer months, hot and humid condition in laborer, and if you have high blood glucose level. The symptoms of dehydration are dry mouth, muscle cramps, nausea, vomiting, syncope, falls, heat exhaustion, etc. Thrombosis or blood clotting is another complication. A combination of high blood sugars and low blood volume makes the blood very thick and increases the risk of blood clotting. And when there is a blood clotting, you notice pain and swelling at the blood clot site. Also, it can precipitate heart attacks, stroke, etc. Individuals are classified into groups based on their health status to identify those who can fast and those who are exempted. This classification will assist not only healthcare professionals but patients and religious authorities. Identifying people who should be exempted from fasting on the medical ground will reassure them and also reduce their stress. Now they can use their time and energy to concentrate on other forms of ibadah. Whereas identifying people who can fast safely will be given appropriate advice, education, and informed decision regarding fasting. There will be individuals who fast despite medical advice. The desire to fast is so strong that their taqwa, their tawakkul, their trust in Allah subhanahu wa ta'ala is so much that they take this challenge and the risk. This is a personal choice. It is imperative to support those who choose to fast and ensure that they do it very safely. Let us see who comes in the high risk group. All the type 1 diabetics whose sugar levels fluctuate, that means their sugars are up and down, and those who were admitted to hospital 3 months prior to Ramadan started. Also, individuals who have poor glycemic control, that means their hemoglobin A1C is more than 6.9. Hemoglobin A1C is an average value blood sugar level, which is like a blood test in the last 3 months. It's a blood test which shows the average value of blood sugar level in the last 3 months. Also, people in this group are those individuals who do not recognize their symptoms themselves when the sugars are very low. Laborers and pregnant women are also in this category. Also, not only just diabetic, but diabetic people with other conditions like high blood pressure, cancer, kidney diseases, and other conditions that add to their risk are also included in this category. Most Muslims will agree that the pregnant woman with diabetes should be exempted from fasting. Recommendation strongly advise against fasting due to clear maternal and fetal risk. There is no studies done involving the pregnant woman with diabetes and fasting. In the moderate risk group comes well-controlled diabetics. These people have a very good glycemic index of hemoglobin A1C of less than 5.8. They may be on medication or even on insulin. And the other group is moderate hyperglycemia. In their hemoglobin A1C is anywhere from 5.8 to 6.9. That is moderate hyperglycemia. In the low risk group are the diabetics controlled with diet alone, and those who have impaired glucose tolerance, that is called borderline diabetes, and their hemoglobin A1C is less than 5.8. So the type 2 diabetics are able to fast safely for up to 1 month, but the criteria is to modify their lifestyle, follow their diet, adjust their medication as per the doctor's advice. This is a conversion chart. It will help to convert blood glucose value if they are in milligram per deciliter to micromoles per liter. Some of the glucometers give the reading in macromoles per liter, and people are more familiar with milligrams per deciliter. So this will help you to convert the value so that you become more familiarized with your test. So, who should fast? High risk group should not fast. Moderate risk group may fast under supervision of a medical professional. Low risk group should be able to fast with good advice. Now, how do I get ready? You should monitor your blood glucose level during fasting to make sure that you are safe. Let me reassure you that this does not break your fast. Invest money in obtaining a glucometer. Make sure your strips are not expired. You should test your blood sugars, including those who normally do not test it. What I mean is, all individuals who are diabetic and fasting must check their blood sugar levels. One should check if he or she is concerned about low sugar or if they feel unwell. Your doctor should provide guidance on self-monitoring of blood glucose levels. Get in tune with your body to recognize your sugar pattern. Discuss smoking with your doctor. Muslim must abstain from smoking during fasting hours. Therefore, Ramadan presents a good opportunity for smoke cessation. Fasting is very powerful and effective habit changer. It is a multi-level system of motives to change the habit. A study shows that Ramadan had a very positive impact on willingness to quit smoking. Remember, Ramadan is all about self-control. Also remember, you are accountable to Allah subhanahu wa ta'ala for the consequences of actions and choices you make. Now the question arises, when do I check my blood sugar? It is important that you start checking your blood sugar 4 hours or even 6 hours after your last meal, which is the Sahri meal. Thereafter, make sure you keep checking every 4 hours to see which way your blood sugar values are. If you feel unwell, make sure you check your sugar right away. Don't wait for the 4 hours. Or if you are acutely ill, do not fast altogether. Make sure that your sugars are checked properly and documented properly so that you understand how your blood sugars are during fasting. When to break the fast. Many of us detest the idea of breaking a fast. However, it is important to realize that Quran exempted from fasting if you are ill. Allah subhanahu wa ta'ala, out of His infinite mercy, has exempted. Do not deprive yourself of His mercy. You should understand the risk of fasting. You should know the symptoms of low sugar, high sugar reaction, and dehydration. You must carry your personal treatment for hypoglycemia as well as monitor your blood glucose levels frequently if you become sick. Our recommendations are based on the American Diabetic Association 2010 guidelines. Blood glucose levels, if it is less than 3.9 micromoles per liter at any time of the fast, you should break the fast. If the levels are 3.9 micromole at the start of the fast, and if you are on insulin, break the fast. Because remember, the sugar levels drop very fast if you are on insulin. If your blood glucose level is more than 16 micromoles per liter, break the fast. Remember, there's a caution for those who operate heavy machinery and operate vehicles like taxi drivers and construction workers. They do not come under this category because they have to be more alert behind the wheel, and they have to break their fast if the sugars are, say, about 5 or so, and their doctor should give them advice depending upon their individual health status. Recommendation for safe fasting: Sahri meal should be as late as possible, two or three small meals after iftar, daytime meals shifted to nighttime meals. Culturally important fried food should be limited or avoided. Do not overconsume. Reduce salt and reduce processed food. Drink plenty of water. Limit or avoid caffeine intake, and avoid fasting when sick. In summary, research has concluded beyond doubt that moderate risk group and low risk group are able to fast safely for up to 1 month. But the criteria is to modify their lifestyle, follow diet, adjust medication as per the medical advice. It is of paramount importance, therefore, to consult your healthcare professional well in advance. Get a general advice about diet, exercise, and monitoring your blood glucose levels. All the diabetic medication should be reviewed, it should be readjusted and altered. You have to learn how to prevent, how to recognize, and how to manage any potential complications or side effects. It is important to bear in mind that certain classes are less likely to cause problems, whereas others are associated with high risk of hypoglycemia. Therefore, you have to see your doctor to get the medication regime which need to be altered. People change doses and timing of the medication on their own without seeking any medical advice because they believe that they avoid unwanted side effects of the sugar reaction with the ability to continue fasting. Make sure you test your blood sugar regularly. It does not break your fast. Do not fast if you are sick. Remember the privilege given to you from Allah subhanahu wa ta'ala. Break your fast when you have to. Always carry a bracelet and glucose treatment with you. Do istikhara before you fast. Remember, you are accountable to Allah subhanahu wa ta'ala for the consequences of the choices and actions you make. Finally, I pray that this video is helpful to you. Ramadan Mubarak. Assalamu alaikum wa rahmatullahi wa barakatuh.